Hello everyone, I'm Dr. Anuj Pachhel, an MBBS graduate from GMC Nagpur, and welcome back to my channel. So today I wanted to do something different. I want to tell you about 5 to 6 stories from my internship year, which has just made me fall in love with life and taught me so many lessons. Now these stories are from my patients, which I had seen during the course of my postings in different departments. Now as interns, we don't do that much with respect to the patient, but seeing the natural course of their entire journey in the hospital, sometimes ending good, sometimes ending bad, just really makes me have so many different thoughts. So I feel like I should share these stories with all of you guys. Now there are certain incidences that happen to you as a doctor when you are especially a junior doctor that can truly redefine and shape the moment of your life, and they will really change your perspective on life in general. Internship was a period of time in my life where really my beliefs on spirituality and God and the entire universe really took a left turn, and I've never seen life and death so closely before. So I really hope that through this video I'm able to inspire some change, some positivity and some experiences of mine which will probably change your thoughts. Just a disclaimer, all the names of the patients which I'll be mentioning over here are completely changed and different from the actual ones which we were admitted for the reasons of their safety and concern. Sharing the natural history of a disease as well as some things which you learn from patient to patient without disclosing their identity is the core, is the backbone of medicine. So the first story is from my very first posting in the hospital, which was pediatrics, and I was particularly posted into the ward. My particular ward was from pediatric oncology, and this is how it starts. In the morning I was told to do some sampling, and I was taught how to do sampling for pediatric patients. There were a lot of children of leukemia admitted into our wards. Leukemia is a form of blood cancer which is very fatal, very aggressive, but there are some forms of leukemia which when happen to children are easily treatable, easily curable. One of these types of leukemia is called as acute lymphoblastic leukemia, or ALL in short. Now ALL has a very different dynamic history. For most of the people getting ALL, it is going to be a bad thing, but the children in between of the ages of 1 to 9 years old, if they are getting ALL, they have actually got a better result. So the treatment works better on them and they have a better resolution to therapy. The chemotherapeutic drugs that we use for treatment of ALL do not cross the blood-brain barrier. So most of the times these patients have to undergo some sort of extra treatment to treat the disease which is affecting the brain itself. And we do that by actually giving chemotherapy directly into the spinal canal so that the chemotherapy reaches the CSF, and from the CSF it reaches the brain itself. Also we have to do separate management for the testis because the blood-testis barrier is also not crossed, and sometimes orchidectomy with sperm preservation is to be done beforehand. We had a small child about 6 to 7 years old, and he was actually suffering from ALL. Every day when I used to visit him in the ward, he used to be so positive. Every day he used to come with me to different places, he used to talk to me, he used to ask me different things. Now like I told you, they also receive a special CNS treatment. This kid was also on that particular protocol. In medical terminology, for curing ALL, the drug that we use is methotrexate, and the procedure that we do is called as ITM, intrathecal methotrexate. That means basically putting the methotrexate injection through the theca layers into the CSF, which will get rid of malignant cells over there. Now this kid already had a few cycles of this ITM done, in which you have to do a lumbar puncture. The patient is lying down. It's kind of a painful procedure for the child, but this kid was so positive, he never used to cry about anything. Since he had been in the ward for a long time because of his treatment, he was very well versed with the terms that we used as doctors every day. So sometimes while middle of working, he used to come to us and say, "Us din mera blast count kitna aaya tha?" And he knew that which day he had an ITM scheduled. So he used to come to us and tell us that, "Bhaiya, aaj mera ITM hai." What really fascinated me is that this kid, he has cancer. He probably has zero idea as to what disease he is dealing with. He's put in a position where there are doctors continuously surrounding him. He's put in a position where I am the intern, I'm currently sampling him, I'm talking to him, I'm taking him outside. Still, he always had a smile in his face. This 7-year-old child was more positive than most doctors we meet. His positivity was literally infectious. I'm very happy to tell you that that child is doing very well now. He has almost been treated completely. And the lesson that I want you all to take away from this is, no matter what situation life puts you in, try to stay positive. It might come out to be in your favor. Maybe you are not aware about how severe your disease is. Maybe you are not aware about what blasts or ITM actually is. If you are just putting a smile on your face and battling life, you are the true hero, man. The next case I came across when I was in my general surgery postings, and I fell in love with the postings just because of interesting cases like this. Now this person was about a 30-year-old man. His name was Kamal, and this person had actually gotten some kind of wound over his hand, and that wound, because of ignorance, had spread to his entire forearm, and his forearm had undergone something called as necrotizing fasciitis. So necrotizing fasciitis is a condition which is caused by a bacterial infection of the skin, and in which basically these bacteria just chew through the entire skin. So you can imagine, like, there is no skin over here. You can directly see the deep fascia, the muscles, the nerves, the tendons, all of which are going, and it is extremely painful because it is continuously exposed to the outside world. Imagine how it would feel if you would get a cut over here and somebody would continuously blow air on it. You would definitely feel some sort of jalan happening over there, some sort of pain happening over there. Now imagine this for the entire forearm, and this all happening in a matter of weeks, which is crazy. So he was admitted to our ward, and the most important thing is that the patients of necrotizing fasciitis needs to be dressed almost every day, and the dead skin which is happening need to be debrided so that the patient does not worsen, because the dead skin which is present can actually worsen the condition of the patient. So I was the person who was tasked for cleaning and dressing of this patient, and sometimes when you do the cleaning and dressing of such infected, such a large wound, such an infected wound, all the tissues around it are extremely weak. During the dressing, there were small veins which just used to get eroded while dressing itself and while cleaning itself, and so this patient had a HB of 5, and every day he used to get some sort of bleeding, which we used to control. Me and my resident, we used to control that bleeding, but this needed to be done, and every day we used to bandage him. Talking more about the case of Kamal, he suddenly developed necrotizing fasciitis, and after so much struggling in the hospital and outside, he finally recovered. But most of the times the outcome for this particular case is not like this. It is such a severe condition which makes the patient crippled, leaving the family to fend for themselves. This is why if you are an individual on which people depend on, and you are the breadwinner of the family, you should definitely have a term insurance plan so that if God forbid something happens to you, your family will be safe. There are several cases where family members pass away unexpectedly, leaving the family in a crippling amount of debt, struggling mentally, physically and financially, where most of the children have to leave their education behind just to support the family. By buying a term insurance plan when the time is right, you are making sure that your family has a cushion to fall back upon in case something happens to you. I've added a link in the description where you can check the term insurance's plans and their different premiums based on your personal details. I suggest if you are a person on which people depend, definitely go for a term insurance plan. It will save your family from a lot of troubles in the future. And don't forget, there's the link in the description to buy one. Now the interesting story is this. Kamal did not have any relatives. The only relative which he had with him was his brother's wife. So he told me about his family history and told me he doesn't have mom and dad. They all passed away. So him and his brother, they worked very hard to sustain themselves financially when they were children. His brother got married to a woman. After a few years without having any kids, his brother passed away due to an accident. So again, only two people were left, his brother's wife and him. Trust me when I say this, I have never seen a woman work for a man. This person's sister-in-law worked for him. Now since this person required a lot of blood transfusions to be done, since his hemoglobin was so low and every day he was bleeding like crazy, she used to go to so many different places just to ask for blood, because in GMC Nagpur blood bank also there are sometimes shortage of a particular blood group, and she worked so hard every day. So the lesson which I actually learned from this scenario is that to support each other, they were trying so hard, because she was not a person who was working. Only Kamal was the earning person of their family. She was trying very hard to save him while he was working hard to feed himself and her, which is completely mind-blowing to see in today's Kalyug. Alright, the third one is from when I was posted in rural hospital Saoner. So every year in internship we have got to do 2 months of compulsory rural training, and we are basically left there completely alone. And this is a very interesting story according to me, because in Saoner I was there for 2 months, and within these 2 months also we are rotated in different parts of the PHC. So sometimes we are sitting in the OPDs, sometimes we are sitting in the casualty, sometimes we are sitting in the mother and child health care, sometimes we are sitting in immunization. So there are 3-4 sections where everyone has to be rotated every week. My first posting started out when I was in MCH, is mother and child health, and in these PHCs we are pretty much the only doctors who are running this place. So we got a woman who was suffering from iron deficiency anemia. She had pallor, she had fatigue, and she had tiredness, and of course she was in the 3rd trimester of the pregnancy. To prescribe her the iron tablets, also take care of her, ask her to visit more frequently, but at the same time she also had a small 5-year-old, and this 5-year-old actually had a chest infection. I was posted in MCH. I told the boy to go to the OPD. Went to the OPD, he took the medicines which they gave. Next week when I was in the OPD, I saw the boy again. The mother was, and I was like, why are you here? Tumhara chest infection theek nahi hua kya? So he said no. So that's when I got to understand that something might be wrong. So we ordered a chest x-ray. I shifted him to a separate set of antibiotics and some syrups, which really helped him get through the infection. Now next week I was in the casualty, and it was the middle of night. It was like 2, and me and my co-intern were just sleeping. Suddenly sister told us that there's this lady who has come to you. So guess what? It was the same lady, and she had come to us with labor. So I was like, for 3 weeks, every single week, wherever I go, I see this kid, I see his mom, I see his dad. So at that time they just saw me and they told me that that, sir, आप यहीं पे रहते हो क्या पूरे समय? I was like, no, yaar, it's just my coincidence that I'm actually here. We took her to the PV room. After examining her, she was like 2 fingers loose at that point. So we knew that the labors have already started, and sooner or later she will be delivering a healthy child. So she was slowly progressing in labor, and morning at around 7:30 when my shift was about to end and some other person was to come in, my co-intern actually got into the ambulance with her and transported her to GMC, where we had advanced labor care facilities. Just because she was high risk due to anemia and different conditions, we transported her over there. So the lesson which I learned from this is that as a doctor you see so many patients every day, and you might even forget about them. But for those patients you are actually very important, then they will remember you for a lifetime. Because all the doctors which I have been through, I remember with the dates and the day ki, okay, Wednesday at 2018 in this particular date, I had some stomach aches for which I went to this XYZ doctor. That XYZ doctor forgot about me the day he met me. So treating all your patients with respect and trying to listen to their problems and providing them accurate solution is becoming very important. Also, most importantly, catching up on different signs and symptoms and ordering appropriate investigations to rule out your diseases is very crucial. The fourth story which I want to share with all of you guys, which I've already shared in a YouTube short which went viral, is about this man that I met in my surgery posting. This is not a very crazy story, does not have any emotions attached to it, but this is one of my favorite stories to tell to medical students. So there was this old man who came to us and he had just abdominal pain, and that's it. He came to us walking. He came to us walking, and it was the OPD day for my surgery resident. After checking him, we found that he has guarding, he has rigidity, and he has tenderness. Also had history of absolute constipation since the last 3 to 5 days. So it was pretty much suspected that he might have some sort of thing related to obstruction. So your intestine is basically one long tube, right? And at any point, if I cause a blockade, somebody just stop the flow of your entire digested and undigested food at one particular point. So that point is what we call obstruction. The bowel loops are so dilated, and they are containing so much amount of fluid because no fluid is absorbed. Sab secretion hi ho raha hai. Your body secretes around 9 to 10 liters of fluid every day just to digest the products whichever you are eating. It is very essential for your body to reabsorb it. Otherwise, you will be completely dehydrated. And our patient was dehydrated completely. So of course, due to all of this, our suspicion was this person has an obstruction. So I, being the intern, was told to go and check on the X-ray of the patient. So I took the patient with me to the X-ray, and this was the X-ray. See it? Yes, it is air under the diaphragm, which is present on the right side, which is characteristic for an intestinal perforation. Not just that, if you see, you will see multiple air fluid levels. So this is basically confirming our diagnosis of obstruction, but this obstruction further complicating as perforation. What is air under the diaphragm for all the non-medicos watching? Ideally, all the gases which are produced inside your abdomen should stay within the intestines. If they are leaking out of the intestine, that means some part of your intestine has ruptured and that gas is rising up, which we can see in a chest X-ray as the black line below the diaphragm of the right side. On the left side, it is very common because your stomach has a lot of gas which you can burp out easily. So we have to always check on the right side. But not just that, look at the third finding in the X-ray which I saw. Out of all the things, I was like, why is there this opacity which is also present? That this person also has a coincidental struvite stone in his kidney. So this person who has actually came to us with abdominal pain, walking, like perforation patient walking is very strange to hear about, because perforation mein intense abdominal pain, the patient will be silent, peritonitis ho gaya, it is going to be very dangerous. But this person came to us walking. Not just that, he has obstruction, he has perforation, and coincidentally has a triple phosphate struvite stone, which is one of the worst kind of stones you can get because it causes a lot of damage to your kidneys. And it is particularly huge. How do we manage this case? Well, you just inform all the findings to your residents and they will manage it on their own. The next day when I come to the ward, he has already undergone surgery, the perforation is repaired completely, and we have already sent out a urology call. What is wrong with this person? Why does he have a stone in the first place? And how do we manage this stone? So the moral of the story is that whenever you are ordering an X-ray, always look at the complete picture. Always try to visualize from your knowledge, are you missing something? Because you might have a provisional diagnosis ki okay, this is intestinal obstruction and this is perforation, but you might get something else. You might get a stone, so which you completely did not expect because the patient had zero urinary symptoms. Thus, it is also very important to identify essential signs which the patient tells you in order to form a perfect diagnosis. And lastly, always trust your seniors, which I did during my general surgery postings. They were amazing. I really missed the internship days. Right, talking about the fifth story is something which I really hold very dear to my heart. It was my trauma posting and I was asked to suture a patient who had a big laceration over his head. This was my very first time suturing. I had gotten zero hands-on clinical experience before that. This was during, I think, 3rd or 4th week of internship where I was posted in trauma, so it was fairly early. My residents were teaching me, okay, this is how you suture, these are the interrupted sutures, these are the mattress sutures, etc. And this was very fun to me. So they, after teaching me, they went away and they said, okay, you are going to suture this case independently. So I'm right there in the morning at around 9. I'm suturing this patient. Whenever I'm doing any procedure, I try to talk to my patients because it eases them. क्या हो गया, कहाँ से हो, क्या करते हो? So I'm a truck driver and my truck actually crashed. I'm like, what? Your truck crashed? So yes, he says my truck literally flipped 360 degrees and then fell down and I was injured very badly. But thankfully he only had a laceration. His CT scan was also normal. So while suturing the laceration, he kept on telling me about his life's problems, and I'm just a 22-year-old kid who is doing his job for the first time, suturing this patient, and he's asking me all sorts of questions कि okay, आप डॉक्टर बन गए हो, आपने कितना अच्छा किया है, अच्छे से सब लोग का भला करना, अगर चाहे तो पेशेंट्स का फ्री में कर देना ऑपरेशन. And I'm just an intern. I'm just there for the first time doing stuff. So the thing which I really like about this incident is that the patients, especially who are the rural ones, they come to you with such hope. They come to you with such a positive attitude and such hope that you are the one person who is going to help them with all their life problems, not just with the presenting complaints that this person had a laceration, but he also asked me life advice on what should I do next, should I complain to the police, should I go to this place, that place. And I'm very, very, very young compared to him. He's like a 55-year-old man, I'm a 22-year-old person. So at that point, very early in the internship, I got to understand what it actually means to be a doctor, what this word doctor actually means to the people outside of healthcare. In healthcare, doctor bole to matlab, it's very common. I have a friend who is a doctor, I have a friend who is a doctor. Nobody cares, nobody respects. It's very common. But to the people outside healthcare, if you even mention the word doctor, it's such a respectable thing. So it taught me to always carry myself with respect as well. No matter what, sometimes we have bad days and sometimes we might feel bad for ourselves. But know that you have worked so much to get to this position. And the fact that you're in this profession is making something very big of an achievement in itself. So to all the people who are watching this video, who are even dreaming about being doctors, the NEET aspirants, as well as the medical students, I just want to say that believe in yourself, man, because you are on this incredible opportunity which will help so many people. From the outside, if you see, healthcare has so many flaws. It has got overwork, it has got toxicity, it has got so many years of studying and sacrificing all your personal life just to help other people. But if you look at it from the outside, you see a man who is just continuously working and serving other people, who is sacrificing his own night sleep so that somebody else's family gets to sleep peacefully at night, who is sacrificing on his own needs and own stuff just so that other person's lives could be better. I think that nothing can be more respectable than this. With that message, I would like to end this video. Thank you so much for watching. It's your boy Dr. Anuj, and I'll catch you in the next one. Please make sure that you are subscribed to the channel because that is one way you can support me. I added a link in the description for Policy Bazaar, so go check it out whenever you're free. Alright, see you in the next one. Bye.